You make my world a better place. I can depend on you.
Oh, that big belly.
In Melbourne at the Kingston Veterinary Hospital, Jasmine has brought in her 12-year-old corgi, Kelvin, who's feeling a bit under the weather.
We had a really big party last night and he ate a lot of food, and we woke up this morning to him vomiting everywhere. His stomach's not normally that big at all. So we thought we should bring him here. We were really concerned.
Hello, Kelvin. Hey, Jasmine, come on through.
Thank you.
What have you been up to, mister? Hey? You been up to some mischief?
Dr Danni Dusek can already tell that Kelvin isn't 100%.
He's looking a little bit sheepish, so I'm interested to see what he's been up to. So tell me what has been happening.
I think he had a bit too much fun at the party last night and he ate a lot of food.
Oh,
Yes.
Kelvin, did you have a bit of a guts, did you, mate?
It's amazing how he sneaks around.
Grabbing a bit here, grabbing a bit there,
That's
hey?
right.
Yeah.
Kel.
You're the master of scavenge.
That's right. Yes.
What sort of foods was he exposed to, do you think?
It could have really been anything. There was like brownies, sausage rolls, pies, lots of sandwiches, and everyone likes to feed Kel. So
Just got spoiled.
yes, that's right.
You've been sucking up to everybody to get little treats all night long, eh? This, unfortunately, is quite a common situation with dogs, and apparently Kelvin, he is known for this. Has he been vomiting or...?
Yeah, this morning he was vomiting a lot.
I think we'll give him a good looking at now, make sure that everything's all right, hey, mate? Just gonna have a little listen to that heart. His heart rate's not up, which is a good sign.
Okay, that's good.
Hey, mate, I'm just gonna
It's
have
okay,
to
Kel.
see how that tummy's feeling. We're very distended there. He certainly seems painful in that tummy.
Yeah.
He's quite uncomfortable with me putting any pressure there, so I'm a bit concerned. So the risk is that if his stomach's actually dilated full of gas and then the stomach twists around, that can cut off all the blood supply.
Okay.
So we'll definitely want to get some x-rays.
Okay.
If Kelvin's stomach twisted around, that becomes a life-threatening condition where we need to go into surgery ASAP.
Oh, Kel.
We've got a picture coming through.
Okay,
What have we got?
perfect, thank you.
Hey,
matey.
Oh. He's having some difficulty walking. Oh, settle.
Hey, buddy.
Hey.
You're right, mate.
On the Gold Coast, a 9-month-old Mastiff has been rushed into emergency in serious trouble.
Good boy.
This Bear. Bear's his name.
Hey, Bear.
Doctors Alex Hynes and Gerardo Poli immediately suspect Bear may have been bitten by a deadly paralysis tick.
He's got a nice short coat, so if there's a tick there, we should be able to find it.
A single bite from the tiny insect can cause paralysis and potentially fatal breathing difficulties. In reception, owner Aaron is anxiously waiting with his baby son Bjorn to find out what's wrong with Bear.
As I got home from work, I just noticed Bear's been really lethargic. Asked my partner, she said that he hasn't moved much all day. He's very boisterous, which is the reason why I knew something was up, so I thought it'd be best to bring him in here.
I think I found something back here. This big dog, Bear, doesn't want to walk. We're always worried in a dog that can't walk in this part of the world that they may have tick paralysis.
Oh, look at this.
Alex has just discovered a tick isn't the culprit.
Wow.
What we found, he's actually got a huge swollen testicle there, so it's not a surprise he doesn't want to walk. He needs some pain relief, and then we've got to work out what we're going to do to help him.
This is going to make you feel better, Bear.
We don't know how long Bear has been suffering with this. It can be an infection. If left, it could spread into his bloodstream. He could die.
Good boy. Tricia, come on, let's go.
At Perth Zoo, elephants, elderly Tricia and younger Permi are being taken for their morning fitness walk.
Come on, Trish, come on, let's go.
Dr Peter Ricci is on his way to join them.
I know we're not meant to have favourites, but I definitely have a bit of a soft spot for our elephants, especially for our old girl Tricia. Hey, beautiful Tricia.
Trish, get over. Good.
She is our 61-year-old Asian elephant. So regular health checks are really important for Tricia. She's an old lady with a bit of arthritis, so I like to keep an eye on how she's walking.
Good girl.
So how is she going with her general health at the moment? Is everything going okay?
Yeah, for her age, she's going extremely well.
Yeah.
Tricia has been at the zoo for 56 years, and senior elephant keeper Kirsty has been looking after her for more than a decade.
Good girl, come on.
Some of my earliest memories are of Tricia and coming to the zoo. For a child, it's just amazing to see that such an animal exists in our world. And I remember vividly the day that the news came out that Tricia had got friends, and it was on the front page of the paper, and we were so excited, and we needed to come to the zoo to meet Tricia's friends. Oh, hello. Perth loves Tricia. We all know her, and we all love and care for her. Who's my beautiful girl?
Only around 40,000 Asian elephants are left in the wild, and with illegal poaching and deforestation, their numbers are dwindling.
They are endangered and special ambassadors for their species, so people come here, fall in love, and hopefully want to do something about saving them. Do you still find that you get amazed by things with them?
Every day, hey, wake up in the morning and pinch myself.
All right, Tricia, time for your medication.
As part of the management plan for her arthritis,
How are you feeling today?
elderly Tricia needs daily medication. But Tricia isn't a big fan of the taste. And she makes her feelings known.
Oh, that's quite a present.
I know how he feels a bit at the moment with my big belly. I understand, it's not very comfortable, mate.
Back in Melbourne, Danni is worried about 12-year-old Corgi Kelvin's engorged stomach after he sneakily indulged at a family party.
So first things first, mate, let's get an x-ray of your tummy, hey? See what's going on in there.
Danni's concerned that Kelvin's stomach is so full, excess gas could form, causing it to twist. And that could be deadly.
I'm sorry, mate, I know you're being good boy. So this stage, I can't tell why that stomach is distended, whether it is food or if it is gas. Any animal with a dilated stomach that's painful, it's a concern. You good boy. Look at us with our big bellies together, hey? So we've got the x-rays all happening, but unfortunately I can't get involved because I've got a little bub on the way. Just want to keep him nice and safe.
Good boy, good boy.
Vet nurses Hannah and Camilla are performing the x-ray for Danni.
Good boy, good boy.
All right, you ready? Oh, Kel. Good boy, good boy. Shh, 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 shh. Beautiful, how'd we go?
He's a very good boy.
Oh, good work. Thanks so much, guys. Let's have a look. Oh, golly. All right, I think we need to get Jasmine in to have a look at this. Kelvin, what are we going to do with you, mate?
One thing we know for sure is it's not a tick.
Yeah.
On the Gold Coast, Alex and Gerardo are investigating the cause of 9-month-old Bear's painful enlarged testicle.
That right one is really large and painful.
I think you're the only one here who can relate to this.
I'm sorry, Bear. I'm sorry for laughing.
All right,
mate.
buddy.
I can appreciate your pain.
There was a few laughs about sore testicles, etc. But I tell you what, Bear wasn't laughing. This is one of the most painful conditions that any animal can have.
Hey, Bear.
all
Be
right.
gentle. I promise when we look in the ultrasound, I'm just going to get a picture.
Gerardo is hoping an ultrasound will provide some clue as to what the problem could be.
There is some fluid around the corner here.
Yeah. We don't know at this stage how serious this is. There's a number of things that can cause this condition. It can be an infection. It can be a twisted testicle that can cause this much pain and swelling. It could be something like cancer. There's really no two ways about it. The best and the quickest treatment for him is going to be castration.
Hey, Bear, you going to be okay? We'll take care of you, mate.
Enjoy your walk? I did.
In Perth, Peter and elephant keeper Kirsty are doing a regular health check with Tricia, the zoo's famed elderly Asian elephant.
Trish was named after Miss Australia 1963, so she shares her name with another very beautiful lady.
How you going, my beautiful girl?
At 61, Tricia is quite old and she's showing some signs of age-related changes.
Tricia needs daily medication to help with her arthritis, but she isn't too keen on the taste. So Peter and the team have to use some tricks to help the medicine go down.
It's just like kids, you kind of have to mask the medication.
What is she like? A bit of peanut butter?
Yeah, it's a lot easier than getting a tablet in that tastes not so great.
Yeah.
So this is an anti-inflammatory.
It's important that we make sure she's comfortable in her final years and make sure that her quality of life improves every year she's here. So let's go give her her medications and a massage.
Cool.
A massage with a special device is also part of Tricia's daily care.
Trish, come on, let's go.
With her powerful trunk, clever Tricia can already smell the peanut butter.
An elephant's trunk is one of the most sensitive parts of its body, so she's using it to smell and feel everything around her. All right, Tricia, time for your medication. Ready? Here's your first sandwich. Good girl. Yeah, all right, there you go. Last one. Awesome, all done.
The massager has also been helping her arthritis.
She would get stiffness in her wrist, but ever since using this, we haven't seen that at all.
There you go. Standing next to the elephant, it's amazing. And for it to be Tricia, the elephant, who is our elephant, is just even more of a connection for me and just means so much.
It's that little bit of connection that we hook into to hopefully get the next generation to try and save these guys.
Yeah. All right. Well, thank you for that, Kirsty, and thank you, Tricia. See you later.
See you, Pete.
For me, it is truly incredible that I came here as a child and experienced these animals, and now I get to work here alongside them and get to know them. And sometimes you're pinching yourself to wake yourself up and realise it is actual real life.
Come with me, have a look at these x-rays.
In Melbourne, Danny is about to show owner Jasmine the cause of Kelvin's massively bloated stomach.
So as you can see, we have a very big stomach.
Yeah.
Normally, the stomach's not going to extend much further beyond these ribs here, so it's very dilated.
Oh, wow. Oh, my gosh.
Looking at Kelvin's x-ray, oh my goodness, I don't think he could have fit any more food into his stomach. But good news is that it is just full of food.
Okay, that's
It's not
good.
dilated with gas, and there's no evidence that it's twisted around. So
Okay.
the stomach is sitting in its normal position, so that's really good news for Kelvin.
Yeah. Oh my gosh, his stomach is huge. I knew it was big, but not that big. Feeling his stomach before, I'm very shocked, to say the least. How are we going to get all this food out?
The fact that he's already been vomiting, I don't want to induce more vomiting again.
Okay.
I really want to just let it pass through normally. And we'll obviously need to keep a really close eye on him to make sure that he doesn't deteriorate in any way. We really just need to monitor him closely for the next few hours. There's a boy. Come on, over here. Just want to make sure that no complications arise from all that food sitting in the stomach. Get comfy.
We're back in a few hours. I hope you feel better, boy. Mwah. Good boy.
That looks really nasty. That must be so painful.
Poor bear.
At the Animal Emergency Service, Alex has just discovered why Bear has been struggling to walk.
All right, just going to pop in here, Aaron, have a bit of a chat.
Fearing a deadly paralysis tick, owner Aaron has been patiently waiting with his baby son for any news.
The good news is we haven't found a tick. What we have found is that he's actually got a really large testicle there.
Okay, yeah.
And it's very painful, and he's also got a temperature. Sometimes we find there can be an underlying cause, like he could have had a trauma to the area, and that could have caused an infection if some bacteria got in, but he's going to need to have that testicle removed. Once we do get it out as well, we can see what might be going on in there, okay?
Yeah. I would prefer him to keep his testicles, but obviously if it's going to mean that he's going to be in pain, then clearly it's the best option to do.
He's feeling a little bit sleepier than he was.
Yeah.
You're right there.
Here he is. There's Dad.
There's your dad.
Hey, buddy.
Hey, it's like Dad.
Aaron is worried, but he knows that 9-month-old Bear is a survivor.
When we got him from the kennel, we had him for a couple of days. We had to take him to emergency because we found out he had parvo.
Parvo is an infectious canine virus that attacks the gastrointestinal system and bone marrow, and if left untreated, can cause death.
Wow, and he survived that.
He survived it, yeah.
Yeah, you're a lucky dog. You're a fighter, Bear, aren't you? So he's going to stay with us and have surgery. Good boy.
At Perth Zoo, Peter's on the move to see his next patient.
My favourite thing about working here is that I get to ride a bike from patient to patient. I just love this place, and getting on my bike and riding around visiting the animals is just incredible.
This time, Peter is going to need to use special protection equipment.
It's an extremely loud patient, so I'm going to need these. You ready to go?
What?
Despite using protective earphones, Peter and vet nurse Lisa can still hear the piercing call of an endangered juvenile red-tailed black cockatoo nicknamed Rowdy. The noisy patient was hit by a car nearly 2 months ago and suffered a nasty break in her wing.
So this is a bit of a tricky bit. We've got to get the mask over her face to give her the anaesthetic gas without getting bitten.
Peter is hoping to be able to remove a device that's been holding the bird's wing in place while it heals. Anaesthetising Rowdy will be the only way to carry out the procedure safely.
This beak is incredibly big and incredibly strong, and I could easily lose my finger if she accidentally gets a hold of me. I've got the gas on. You can see her little eyes getting sleepy now. You happy she's asleep? Yeah. Yeah. Birds metabolise the anaesthetic drugs very quickly, so now we've got the mask off. I've got to get my tube in quickly or she'll wake up. That's in. If she were to wake up, there's a real risk that she would clamp down on my finger while I'm putting that tube in, or she will clamp down on the tube and actually bite the end off and we could lose it into her airway. All right, so I'm just going to open her beak. Ah, she bit me. Just checking.
Not funny.
Such beautiful birds. One of our most amazing West Australian species right here. And you can see this beautiful girl. She had some feathers missing from her injuries when she got hit by the car, but she's starting to regrow them now, which is good. This is her external fixator. This has been in place for about 7 weeks now. It's basically a bit of metal that's going through her bone and coming outside of her body, holding that bone together.
It's this device that Peter is hoping to remove today, but only if the wing has healed enough.
Let's position her for x-rays.
Have you set that to 75 centimetres?
If the wing hasn't healed properly, it could spell the end of Rowdy's chance to return to the wild.
Butternut. Hey.
In the Sydney coastal town of Collaroy, Dr Lewis Hunt has arrived for work to find Butternut, the clinic cat, has been up to mischief.
Butternut, what are you doing in there?
Butternut, troublemaker. Butternut's worst trait is her food stealing. Every day we catch her opening a fresh bag of food, having a few mouthfuls and getting to the point where we've just got to give that bag of food away. She could reopen the same one and that'd be fine, but no, every day it's a new bag.
Ash, look what your Butternut has done.
How many bags is out this week?
One.
I would hate to know the number of bags that have been opened that I'm not aware about. I know the nurses keep it very quiet and make those bags disappear without me ever finding out.
We do have something called a Butternut discount. So some clients know that she rips into food, so there's a Butternut discount if they buy any bags that are ripped.
I'm the only one who realises that you're not as sweet as you look, eh?
Butternut, I think, fell on her feet when she ended up here as a kitten. We were trying to rehome and no one took her and got to the point where she just never left. She's in charge. Butternut is definitely in charge. While Butternut's food stealing is not ideal, she actually does play a purpose here. She's the resident blood donor, and she saved about 3 cats, I think, she's donated blood to over the years, and all those cats have made it through. So while we give her a hard time about stealing food, deep down she's fantastic.
Gonna come out? Can you walk out? Hey, you're a bit big to try and carry.
On the Gold Coast, it's time for Bear the Mastiff to be anaesthetised for surgery on his painful swollen testicle.
Wow, good boy. Poor Bear.
I can imagine it feeling like a vice. We'll take that vice off your testicle.
Okay, you ready to go to sleep? Good boy. Off to sleep. Okay. There we go. There we go. Good boy.
Alex and Gerardo will be performing the surgery, with vet nurse Tara assisting.
So what we're going to do today is we're actually going to perform a castration on Bear. This is an operation that's done all day, every day in vet practices around the country. But in emergency, this is something we don't actually do very often.
How long since you've done a... Oh, man. It's been a long time since I've had to clip some testicles.
Yeah. We need to get these testicles out because that one testicle is really causing him a problem.
Both testicles will be removed as a precaution, in case tests reveal that the problem has spread.
Okay, is he nice and sleepy? So we'll remove the good one first.
So that's the normal one, Alex?
Yeah, that's the normal one. So
pretty big.
I know, isn't it? One testicle out.
Goodbye, friend.
Goodbye.
Now it's time to tackle Bear's larger abnormal testicle.
It's so swollen and so adhered because of all the inflammation that it doesn't want to move, which means it's really hard to cut it out. I think what I'm going to need you to do is push it up. That is stuck there. We're going to really have to put some pressure on there. This tissue is so firm and thickened. Nothing here is normal.
Look at the fluid that's coming out of there.
No, that doesn't look healthy at all.
The vast amount of fluid could be due to infection and maybe sepsis, where the body reacts to a potential infection by shutting down organs.
The diseased testicle looks really bad. When you have tissue like that in the body, they can become septic really quickly and it becomes life-threatening in that situation.
He can die.
At Perth Zoo, Peter and his team are about to take an X-ray of Rowdy, the red-tailed cockatoo's wing. They're hoping that the break, which happened when Rowdy was hit by a car, has healed.
So I'm just assessing this bird's range of motion in her wing. This is her fractured wing over here, and you can see this wing is a lot tighter. All the ligaments and tendons have contracted down in response to this fracture and the healing. She's going to need time for this to heal and to re-stretch and reuse these muscles normally, and that's where the rehab process comes in, where she's going to learn how to use this wing again.
Just feel it, make sure our bones are in the right place. Yep, okay.
The X-rays show that Rowdy's wing is healing well, so Peter can start by removing the stitches.
Just these couple here.
Yeah.
Next, he needs to unscrew the external fixator that's been bracing the wing.
Essentially what she has in her wing is a series of pins and connectors, and the fracture is about here, and they're stabilising the bone either side. Once I remove this support beam, her fracture's no longer going to be stabilised, and I've just got to be careful that it is healed properly, because if it's not, we could re-fracture her wing. Now we just want to have a good feel of it. It feels really good. The fracture feels like it's healed properly and there's no movement in it. It's great.
Peter's confident he can now remove the remaining pins.
So I've just got my chuck here to help me unscrew them.
The pins have to be gently removed, with Peter aware that the delicate wing could easily re-fracture.
There we go. All right, so this last one here that's bending up is going all the way through the bone at the moment, so right through the middle of that bone, and it's going to be a little bit more difficult to wiggle all the way out, so I've just got to be careful with this one. There it is. So you can see it was all the way inside that broken bone. One side of the fracture here, another side of the fracture here, and this would have been holding those two sides together.
It's time for the cockatoo to wake up.
I'm going to turn him off. So birds do tend to wake up a lot quicker than other animals.
Lisa must maintain a firm grip in case Rowdy strikes out with her powerful beak when she returns to consciousness.
Come on, sweetie. Time to wake up and feel your new wing. Oh, there's the eye. You gonna have a chew? There we go.
The last step for Peter and Lisa is to get Rowdy back in her pack without incident.
Don't let go now. Watch out, yep. She's awake. She's back in her pet pack and ready to go back to the rehab centre.
Removing the brace is a milestone, but this young cockatoo still has months of recovery ahead. It could be a year before her wing is fully healed and she could be released back into the wild.
Nothing here is normal.
At the Animal Emergency Service, Alex and Gerardo have successfully removed Bear's healthy testicle, but the infected one is still stuck firmly in place. It must be removed or Bear could die from infection.
I'm actually going to try and break down some of these adhesions with my fingers. Sometimes using your fingers can be the best way because you get behind the testicle and really try to break down those fibrous bands. All right, try that.
Okay.
That's it. That's it. There it is. Wow. Look at that. There is nothing healthy about that testicle.
The testicle is clearly infected.
Look at that discoloration there. That is actually already starting to die off.
Yeah.
So that would have made him really sick very, very quickly. He was
just a true emergency.
very lucky we got in there.
There we go. Okay.
It's the other one there.
Put them for comparison, yeah.
So
wow.
yeah, look at the size difference between those two and the colour difference. If this had gone on for too much longer, it would have actually made him septic. So the infection could have actually spread through his body. He could have died. So he's a lucky dog.
I think I can say for every male out there, as much as you want them, I'm fairly certain he doesn't want that one.
Yeah.
He's going to feel a lot better.
Nothing about this was a normal castration. I really could see how lucky it was that Aaron had brought Bear down to us.
But Bear isn't out of the woods just yet. The diseased tissue will be sent to pathology to be tested for cancer. And it will be a few hours before Alex will see if this brave young dog's paralysis has improved.
Hey, Mr. Bear.
It's okay. You're okay.
At the Coleroy Plateau Veterinary Clinic, Kylie and her son Max have brought in their 18-month-old dog Mystery. Sensing a canine intruder, clinic cat Butternut is beating a hasty retreat.
Can you open the door for Mum, please?
Thank you. Mystery was outside in the yard and she screamed, jumped, and then I saw
what I thought was a snake fly.
The shy rescue dog has had a nasty encounter with an Australian water dragon.
There wasn't any blood or anything, so we just sort of kept an eye on it, and she was fine last night, and then today... She started limping because I was going to take them for a walk, wasn't I?
Hi, Kylie. How are
Hi.
you?
Good, thank you.
Hello, Mystery. I hear Mystery's been taking on water dragons.
She has.
Oh, sweetheart, that's no good. Water dragons are native to the east coast of Australia, and they're a lizard that can grow up to about 1 metre long. Normally the water dragon would have taken off, but he's obviously gone toe-to-toe with Mystery, and Mystery's come off worse for wear. All right, so yeah, obviously sawing that foot there,
Yep.
so we'll go through and have a little look at her. Hey?
Sounds good.
I don't think I've ever seen a dog bitten by a water dragon. I've seen dogs bitten by snakes and spiders and that sort of thing. So this is a first. So this is Mystery's attacker. This is a water dragon, a fairly impressive looking lizard. These guys have got really sharp spines, really sharp claws, sort of used for climbing trees and that sort of thing. And unfortunately for Mystery, they've got really sharp teeth as well. Come on, Mystery, you got to come and say hello, sweetheart.
Come on. A water dragon's poisonous?
No, luckily water dragons aren't poisonous, but they've got a mouthful of bacteria, so when they do bite, the wound can then get infected. I'm not surprised Mystery is sore in that leg, so we'll have a good look at those feet.
She's not very good at letting us touch her feet, so good luck.
A lot of dogs, but particular rescue dogs, hate having their feet examined, and I think it quite often comes from the fact that their nails are being cut too short as a puppy, and that really hurts, and therefore they hate anyone going near their feet.
You're okay. You're okay.
Really?
You're okay. You're okay. You're okay.
Poor old Mystery really doesn't want me to have a look at her foot. It's a bit of a balancing act, trying to get a good look without being bitten myself.
You're okay. You're okay. You're okay. You're okay. You're okay. You're okay. Here.
It's getting to that point. If I can't get a look, we may end up having to sedate her. I'd like to avoid that if I could.
You're okay. Good girl.
All right, mate, time for you to go home, hey?
In Melbourne, greedy Kelvin has spent most of the day under observation, and Danni is satisfied he's now out of danger after his party food indulgence.
Yeah, we're still quite full. It's going to take a few days for all that to pass through, I think, hey? Bit of digestion. Be on a bit of a diet for a bit, I think. Come on, mate. Where's Mum? Where's Mum? There she is. I'm happy that Kelvin is all good to go home. He's been nice and stable, hasn't had any more vomiting. The biggest challenge for Jasmine and the whole family is going to be not feeding Kelvin. I think he just gives them those puppy eyes, and how can you say no? So I think for tonight, no dinner.
Okay.
How are you gonna go with that?
I'll try. We'll see how it goes.
He's gonna try and get it out of you, I know. I think he's got plenty of food in there to last him a bit. If he's doing well, you can start to introduce food, but just small amounts.
Thank you so much.
It's okay. You take it easy, guys. Alrighty. Home time, Kel.
Let's go, Kel.
Come on. See you later.
You're okay. Good girl.
Back in Coleroy, Lewis is struggling to get a closer look at the nasty bite on Mystery's foot from an Australian water dragon.
You're okay. Good girl.
It's getting to that point. If I can't get a look, we may end up having to sedate her. I'd like to avoid that if I could.
You're okay. Good girl. Good girl. You're okay.
When I finally get a look at Mystery's foot, that toe of hers is a little bit swollen and super sore to touch. Oh, sweetheart, hey?
That was hard work, wasn't it?
Really tough. I think I'd be inclined to treat her with some antibiotics at this stage. If we don't treat Mystery's bite, there's a real possibility that wound will get infected and really painful for her to walk on. You can see that one there is actually a little bit swollen.
Oh, it's
and
okay.
very sore there,
And there's
aren't you,
Max,
hey?
she wants a cuddle from you.
Yeah, Maxie will look after you. You guys are best buddies, aren't you, hey? Oh, you good girl? So we're going to start Mystery on some antibiotics and give her an injection for pain relief as well, because she's obviously sore. Come on. There you go. Done.
Mystery needs a second jab, but now she's extra wary.
Come on, Mystery. It's all right, sweetie, eh?
And come here, Mystery. Let me hold your head for you.
Come on, come on. There we go.
Come here. You're okay. You're okay. Good. Good girl. You're okay.
Mystery, did that sting, hey? Oh, come on.
Oh, did he really hurt you? Oh, come here. Oh, it's okay.
I thought Mystery was going to be much braver. She really carried on after I gave her that needle. I think she thought I'd stabbed her rather than just gave her a little injection.
Oh, sweetheart, that wasn't that bad. You're a big sookie lala, aren't you, hey?
It's okay.
Yeah, I'm on. Oh, yeah, it can't have been that bad. I'm happy to take your treats.
And turn my bottom to you.
The fact she took a treat right out of my hand immediately after the injection shows it didn't really hurt that much and she was just carrying on.
Well, tail's wagging again.
Yeah, bribery at its best.
Yeah.
Are you smart enough to hold a grudge, hey? There you go, you're going to forgive me.
It's really important that Mystery and I leave on good terms because if she leaves after I've looked at her feet, given her lots of needles, she won't want to come back here. But if we can try and sort of just resurrect that bond with a few treats and cuddles, hopefully she won't have such bad memories and hopefully she'll come back and see me again.
Oh, Maxie will look after you, won't he, hey?
Yeah.
Yeah?
Yeah, Mr. I'll look after you.
Yeah.
Yeah. Thank you very much.
Yeah, all done.
Say bye.
All right, Carly.
See ya. Hopefully you
later.
won't see us back.
Yeah, hopefully not too soon.
Now, I'd be surprised if we have to see Mystery again. Obviously, if she doesn't respond to the treatment, we will. So she'll be feeling a lot better by tomorrow morning. All right, see you, Mystery.
Thank you. Bye.
The next morning on the Gold Coast, Aaron is back to pick up Bear. It's only been one night, but the family has missed him.
They're all going to be very excited to see him. So, yeah, so I'm sure he's going to be excited to see them. So yeah, no, it should be good. So, get him home.
Bear! Hello, matey. Look at you. Good boy. Come on. Hey?
Alex is also excited to see her patient.
Bear is looking so much better this morning. Oh, look at you. You're walking. Hey? Good boy. You have been through so much. Oh, look, I got a big kiss. Oh, good boy. Good boy. He is still a little bit swollen back there. That swelling will go down in the next couple of days and you won't even be able to tell. I think there's someone here who's going to be very happy to see you. Come on. He's walking a little bit bow-legged and that's not surprising. That wasn't just any normal castration. That was a big surgery that he underwent. Bear still needs to rest. He's been actually quite sick, so the most important thing is just that he's given time to recover. I still look at him this morning and think, wow, Bear, you are one lucky dog. Look who's that.
Hello, buddy. Hey. Hey. Chelsea.
Yeah. My favourite moment is when I bring that patient out and they see their owner again. It's a beautiful time. It was actually an infection.
Glad I brought him down when I did then.
Yeah, time really was a key factor.
Yeah.
Yeah, lucky boy.
Ready to go home, buddy? Thank you for everything.
We don't want to see him anytime soon, if possible.
No.
Poor Bear. This boy is only 9 months of age and he's already survived parvo and now an infected testicle that's almost taken him out. I love this dog, but I'm really hoping that Aaron doesn't have to bring him back to the emergency hospital ever again. Hey, you stay out of trouble.
But Alex won't be able to fully relax until she's got Bear's test results back from pathology.
Thanks again.
See you, mate.
In Melbourne, Danny has almost finished for the day, but has one last patient at a local wildlife shelter.
Hi, come in,
Michelle,
Danny.
how are you?
Good, thanks. Come in.
That's good. Got a patient for me, I
yes,
hear.
I have.
Michelle runs one of the largest animal rescue shelters in suburban Melbourne.
I have 60 different animals at the moment. Possums, lorikeets, galahs, cockatoo, a shingleback.
Michelle's latest arrival is an injured magpie.
Where's this little Maggie hide? I'm gonna come out here and bring him. Oh, sweetheart, okay.
I absolutely love magpies. They do get a bit of a bad rap, but they can be such lovely little characters, so I hope people learn to love them a bit more.
So what's happened to this little guy?
It's been attacked by a raven. It's got an ulcer in its eye and it's got a puncture in its head.
Oh, sweetheart, you poor little thing. Carers like Michelle are just, they blow my mind. The commitment that they put into what they do is just phenomenal. Her whole life revolves around these animals and, you know, without her help, they wouldn't end up back in the wild. All right, here, mate. That's all right. Here, oh, darling. It's all right, there. Yeah, sweetie. So that eye there, it's all caked over at the moment. I need to get a bit of saline to clean up that eye a bit to see what it looks like underneath. I'll hand him back to you so we can have a little look at that eye. So the discharge is basically from infection and inflammation.
Right.
Just lots of white blood cells and inflammatory fluids. After clearing away the discharge, I can see that those eyelids are quite swollen. He's also not wanting to open and shut his eyelids by himself, so whether that's just from all that swelling or whether there's some neurological damage, only time will tell. All right, so we'll just see if we can stain up that cornea to have a look for any ulcer. We use a dye called fluorescein to show up any defects in the cornea. I'm just gonna have a little look and some magnification. Very groovy looking magnification. So we'll just have a little look to see if there's any ulcers there. Okay, so there certainly is an ulcer there. So I think the best thing at this stage for this little Maggie is going to be lots of TLC, some antibiotic eye ointment, and ideally a bit of pain relief and anti-inflammatory to help with the swelling around the eye as well. And then we'll just have to keep a really close eye on the eye. We'll have a little look at this laceration that was on the top of the head too. Oh, well, that's healing up really nicely, so I'm not too concerned about that. There's no sort of signs of infection going on there. Doesn't look very inflamed anymore. So what have you been doing? Perfect. Good job. All right, so it's just that eye and hopefully we can get that back under control and we can get him back home again.
Terrific,
yeah. Hey?
Thank you so much for that.
Oh, it's such a pleasure. Such a good little patient though, hey? You have?
Before Danny leaves, Michelle has a surprise.
Who's in here? Come on, Bubba.
I wasn't expecting this.
On the Gold Coast, Alex has received the results from the biopsy after Mastiff Bear's emergency castration.
We sent away the testicle to the lab and the good news is it came back as a simple bacterial infection.
Okay,
what do we got?
Thank you.
It's Bear. Bear's his name.
He's having some difficulty walking. Oh,
If we hadn't removed that testicle, it could have led to sepsis. That's an overwhelming infection that starts to spread to other parts of his body. It can be deadly.
Look at the size difference between those two and the colour difference.
He's going to feel a lot better.
We don't exactly know how Bear got this infection, but the great thing is castration and a course of antibiotics, and he's well on the road to recovery.
Oh, Michelle, what a treat. I wasn't expecting this.
I thought you'd like to see them.
Oh,
They're so beautiful.
yeah. They're just gorgeous.
And they were due for a feed, so
Why
gives
not?
me a break.
Oh.
Back in Melbourne, Danny's delighted to be able to help wildlife carer Michelle with two very precious babies.
Got a little ringtail possum here. Oh, darling. Are you going to have a feed? How often are you feeding these guys at the moment?
Every 4 hours through the night.
Yeah, great.
Hopefully within a week or two they should be old enough to start drinking themselves, where I can just leave the milk and the branches in there, but at this stage they still need mum's milk.
Here in Michelle's property, it's like a little sanctuary for all these animals. She's just doing such a remarkable job. It's just mind-blowing. It must be impossible not to get attached when they're so cute.
Oh, it's very hard. They're just so cuddly.
It feels amazing being a vet and actually being able to make a difference with wild animals, to be able to actually step in and get them back out to where they belong. It feels really good.
Hi, I'm Dr Danni Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.